Hello everyone, this video presenting the disorder of fatty acid oxidation. So, what is fatty acid oxidation disorder? Let's take a look. When fat is needed as an energy source during periods of decreased intake, prolonged fasting, or increased energy demands due to illness, fatty acids are released from storage in the adipose tissue and undergo mitochondrial beta-oxidation. Therefore, the definition of fatty acid oxidation disorders, FAODs, are inborn errors of metabolism due to disruption of either mitochondrial beta-oxidation or the fatty acid transport using the carnitine transport pathway. Moving on to the etiology of FAOD. Fatty acid oxidation disorders are caused by mutations or changes in a gene which then cause an enzyme to be defective or not produced. FAODs are all inherited in an autosomal recessive manner, meaning that parents can be carriers without themselves having the disorder. So when a child inherits a recessive gene from both parents, the child will have the disorder. The enzyme most commonly deficient is MCAD. Other enzyme deficiencies include SCAD, LCHAD, VLCAD, glutaric acidemia type 2, and TFP deficiency. Most of these disorders begin in infancy. Now, let's move to the pathophysiology of FAOD. During the neonatal period, affected infants can be identified. Children with these conditions may have no symptoms when they are healthy and eating well. Symptoms are frequently triggered by illness and exertion, and they may worsen if treatment is not initiated promptly, which is more likely if the condition is undiagnosed. The symptoms are fever, vision problem, muscle cramps, drowsiness, little appetite, and diarrhea. Symptoms differ by type of disorder and by individual. It may start anytime between birth and 3 years and may be mild or severe. Children with MCAD have a significant risk of death during the first or subsequent clinical episode of hypoglycemia. In most cases, the first episode arises following illness or fasting and occurs in infancy or early childhood. FAODs also can cause recurrent episodes of hypoglycemia. Clinical findings may include lethargy, hypertonia, failure to thrive, persistent vomiting, hepatomegaly, rhabdomyolysis, and Reye syndrome-like episodes. How FAODs are being diagnosed and assessed? Firstly, newborn screening (NBS). It is performed by using the tandem mass spectrometry. Individuals with positive NBS are seen at metabolic centers for further testing before confirmation of a diagnosis. Second, analysis of fatty acid beta-oxidation. It is used in the checking for remnants of the fatty acid breakdown process in cultured cells or enzyme activity in cells of the blood, liver, heart, or muscle to confirm the diagnosis. Thirdly, as a carnitine profile test. It is necessary for diagnosis following an abnormal NBS. The FAOD can all be recognized by the specific carnitine profiles and free carnitine levels. Lastly, genetic or DNA testing. It is to identify the type of mutation and help the genetics team to create a treatment plan. The nutritional assessment for FAOD disorder can be done by: first, assess the personal data of the child such as name, age, and medical history. The second one is assessing the child's family history. This is crucial as FAOD is due to genetic mutation. Hence, by assessing both parents' history, whether they carry the abnormal gene, it can confirm the diagnosis. The anthropometric measurements such as grip strength tests can be done to assess the symptom of hypertonia in patients. Measurement of weight for length, weight for age, and head circumference as well as skin folds for children less than 6 months are important to see any sign of failure to thrive and body mass or fat mass. For the biochemical parameters, tandem mass spectrometry is usually used to determine the free carnitine and carnitine for the diagnosis of inborn errors of metabolism. Medical management. Immediate treatment of MCAD deficiency attack is with dextrose given by vein. There is no specific medication that can cure FAODs. However, there are a few supplements that can be consumed for a healthy body. These supplements may help in processing the food that the patients eat. With no approved specific medication for treatment of FAODs available, triheptanoid is a promising agent that is currently used in compassionate care programs. Triheptanoid is a highly purified, synthetic 7-odd-chain fatty acid glyceride that can bypass the deficient long-chain oxidation. The gene transcription activation is by using bezafibrate. Bezafibrate is a peroxisome proliferated activated receptor agonist that promotes transcription of many genes, a potential treatment that requires more clinical studies. Nutrition and lifestyle management. Avoidance of fasting. Infants need to be fed every 3 hours with no more than 4 hours of fasting at age 0 to 4 months. An additional hour of fasting is allowed per month of age, thereafter up to 8 hours until 12 months of age. After infancy, it is important that children avoid fasting for more than 10 to 12 hours overnight. Providing oral or enteral carbohydrate-rich foods every 3 to 4 hours during the day and night to maintain blood sugar and hydration if patient is able to drink. For example, Gatorade, Pedialyte mixed with salt carb, powdered carbohydrate, glucolin, valence carbory glucose polymer, and Hurix glucose powder. Also, give uncooked cornstarch that kind of gives slow release energy or glucose supply throughout the night. Next, eat on regular basis. People with FAOD may need to eat often to prevent health problems. Babies especially may need to eat every 4 to 6 hours or more often, including during the night. Besides eating on a regular basis, people with this FAOD may need to follow a meal plan that's high in carbohydrates and protein, but low in fat. They can eat foods like bread, pasta, fruit, vegetables, lean meats, and low-fat milk products such as milk, cheese, and yogurt. Supplements. In some circumstances, patients will be suggested the specific vitamins to help them cope their symptoms. They may be prescribed medium-chain triglycerides oil, riboflavin, and carnitine on a regular basis. Fat-soluble vitamins also will be prescribed as they have lesser store in the body and need to be supplied often. L-carnitine supplement is for babies with COD or MCAD. It helps remove harmful substances from the body and helps in energy production. L-carnitine plus MCT oil is for babies with LCHAD, TFP, or VLCAD. It helps the body make energy. Docosahexaenoic acid DHA is for babies with LCHAD. It helps prevent vision loss. Avoid prolonged exercise, however, can kickstart tolerance by having MCT and carb supplementation prior to exercise. Avoid exposure to cold temperature, as this will cause shivering, thus increase metabolic demands of patients. Lastly, aggressive treatments during sickness and emergency, such as TLC, tender loving care, IV glucose, and family is provided with emergency protocol. Now, we head to diet suggestions. First, carbohydrates. Someone with fatty oxidation disease needs their bodies to break down carbohydrates for energy instead of trying to utilize fats for energy. A carbohydrate-rich diet will not only assist the body of the patient, but it will also minimize FAODs from experiencing low blood sugar, which can be fatal. As for fats, avoid taking long-chain essential fatty acid foods such as butter and fatty meals. Supplementation with specific oils may be necessary to meet essential fatty acid requirements, such as flaxseed oil, walnut oil, canola oil, corn oil, and soy oil. Patients are recommended to consider a low-fat diet since their bodies are unable to break down fat in the mitochondria properly and efficiently. Keep away from high-fat foods like fried meals and fast food. The intensity of the disorder and the person's age will determine the specific restrictions. Symptomatic infants need to discontinue breastfeeding due to the high fat content in breast milk and start specialized MCT supplemented formula. For proteins, a high protein and low carbohydrate diet can help manage symptoms while also improving body composition and liver lipid levels. Because a high carbohydrate diet can contribute to obesity, substituting healthy proteins for some of the carbohydrates may be beneficial. Next, drink plenty of water. Drink a lot, especially when exercising. Staying hydrated will help the muscle cells to work better. If you don't like to drink water, opt for herb tea, iced tea, watermelon, oranges, or non-Coca-Cola soft drinks. Sports drink will be good too. Eat a snack before exercising and during prolonged exercise. Don't go for longer than 2 to 3 hours without having a meal or snack. Munch on nutritious snacks like crackers and low-fat cheese or low-fat cream cheese, graham crackers and a glass of skim milk, low-fat granola bar or cereal bar, and low-fat yogurt. Thank you for watching. These are our group members. And here are the references that used in this video.